The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, baby. Your hosts are Ciarra Morgan and Samantha Kelly. Ciarra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Welcome back, everyone. Today, it's another Ciarra and Sam only episode, and we are going to talk about informed consent and shared decision-making because we hear the buzzword informed consent a lot, but I don't think that people really know what that means all the time. And we don't hear enough about shared decision-making. And informed consent is our jam, right, Sam?
I don't know how we've gotten 2 years almost, nearly 2 years into this podcast without having this episode. Like, if you've talked to us, we talk about this all the time. So I'm not sure how we have not shared this yet.
Do you remember when I first had this idea of doing a podcast and I gave you like 20 episode ideas I already had? And then you were like, Ciarra, we just need to not put them out too fast because we're going to run out of ideas of things to do. And I don't want to just burn out and then we don't have any more material. And then here we are.
We just love to hear ourselves talk, I think is what it is.
I actually don't love that part. I don't love that part. I don't listen to our podcast.
I don't either.
My sweet husband puts it on mute in times 2 because he wants us to have the download because he thinks that one download really helps us out. Thanks, babe.
Thanks, Kyle.
Thanks, Kyle. Okay, so hit us, Sam. What is informed consent other than my jam?
Ciarra's jam. That's what informed consent is. So informed consent, I'm going to give you the full-on definition, and then we're going to dive into what that actually means. So informed consent is the process in which a healthcare provider or researcher, but in what we're talking about, healthcare provider fully informs a patient about a proposed medical procedure, treatment, or whatever it is they're proposing. It gives them all of the benefits, the risks, the alternatives, and gives them the opportunity to decide if they would like to consent to that or not consent to that treatment, procedure, whatever. So that is what informed consent is. It's just the process of your provider telling you why they think you should do this and what the research says and what else you could do, and then you deciding if you want to do it or not. So informed consent implies that someone is consenting to that thing, which means you have to be given the opportunity to say, yes, I'd like to do that, or no, I would not like to do that. So why is this important?
Well, if somebody comes in and says, okay, we're going to check your cervix now, or okay, we're going to break your waters, that is not informed consent because you were not given an option of one or the other. And even though you can say no, most people don't because they were just told by a provider that you're going to do something. So you're a good girl and you do it because that's just like what we're ingrained with. So if your provider is not automatically giving you informed consent by telling you what all of these options are, if you have a doula, they can help you ask these questions, but you can use your brains. I always feel like it's Halloween if I'm saying that. So brains, anytime you are proposed with an intervention. So that could be during your 37-week checkup and they want to do a cervical exam just to check and see how dilated you are. For funsies, because it's not a crystal ball. Anyways, we have an episode about cervical exams if you want to go back and listen to us rage about it. So it could be something as simple as that, which doesn't seem like a huge intervention, but it is an intervention. And it could be something as serious as we need to induce you or we need to add Pitocin to augment your labor or whatever. So anytime, whether in pregnancy or in labor, you are being proposed with some sort of intervention, you need to ask the following questions if these are not automatically being given to you, which with some of our providers, they are, which is amazing.
Mm-hmm.
And some people are really lacking in this department. B, what are the benefits of XYZ? R, what are the risks? A, what are the alternatives? I, what does my intuition tell me? This is a question for you. I like to say it's a gut check, but that would be a really weird acronym. N, what if we do nothing? And S, please give us space to make a decision, just me and my partner, or just me, my partner, and my doula to talk about it, because you should never have to make a decision with somebody watching you and talking to you during that process. You always have the right to ask somebody to leave the room, even if it's emergent. Now, in an emergency situation, you're probably going to be able to feel that it's truly an emergency, and you'll probably rush and make a faster decision. But we have had stories of OBs locally who the person is like told they need to do something. The patient, I hate that word, says, I just need like some space to think about it. And the provider just stands there. And the doula said, she just wants a little bit of space so that we can talk, like that she can talk about it. And the provider crossed her arms and said, we are talking about it, and just stayed. Yeah. So there can be combative situations, but usually when asked for space, most people will dip out of the room for a little bit.
And, in those emergent situations too, space can just look like you and your partner and your doula, like talking about it, like all huddled up together. It doesn't necessarily mean that, the providers aren't running around the room getting things ready. Like in a situation, maybe it's a situation where we're talking about using a vacuum to help the baby be delivered. They might be going ahead and getting that vacuum ready in case you are ready, in case you do consent to that. But that could be you looking up at me and your partner as the birthing person and saying, what do you guys think about this? And, we can have that conversation real fast there. It doesn't have to be a full, okay, let's take a second here. I know baby's heart rate is really low and you really want to use a vacuum to expedite delivery, but let's take 5 minutes to ourselves. It doesn't necessarily have to be what it is. But if it's a non-emergent situation, then absolutely having that space where you don't have people looking at you is important. And even as the doula, I will always offer to step out if you would prefer them, to have that conversation with just your partner, especially when we're talking about bigger interventions, like going for a cesarean or using, oxytocin, Pitocin, whatever, all of those things.
Cut your tongue out.
I know.
You just called it oxytocin. I could punch you in the face. You're so lucky you're not in front of me.
Synthetic oxytocin.
They're like, man, Ciarra's violent today.
Our conversation last night messed me up.
I know we did. We had somebody text us and say that that the oxytocin was stressing the baby out. Mm-hmm. That's really funny.
So as we're talking about informed consent, I think that something that goes into informed consent as a part of informed consent is the shared decision-making model. And I don't think this is talked about as much as informed consent, but it is a really important, I don't know if I would say it's a part of informed consent or if it's just kind of in conjunction with informed consent. They kind of work together, really.
It is hard to separate them. You can't really separate it.
Yeah. And I mean, informed consent, I guess, maybe informed consent is a part of shared decision-making is really what it is. So,
yeah, when you have somebody that is willing to be having you in the conversation, you're doing shared decision-making, informed consent is a part of that. That's a good way of looking at it.
Yeah. So shared decision-making is the process where the patients and healthcare professionals work together to make healthcare decisions. So it's going to be based on the evidence and the provider's recommendations. It's going to be based on you as the patient, your individual values and your individual health history. And then it's going to be also the preferences of the people and, what your goals are. So it's these kind of like three things working together. And so part of that is that you do need to know, the brain of it all. We need to know what all of those things are so that you can kind of figure out what that shared decision-making looks like. And so that means that shared decision-making model means that blanket recommendations for everyone, that's not shared decision-making because I am not the same as you. What's recommended for you is not something maybe that's going to be recommended for me because we are two individuals with different health histories, even though we have the same number of children. We're relatively close in age. We live similar lifestyles, but we're still two different people with different physiologies and biologies and psychology. And that's a big part of it.
We shouldn't be treating the 99%, like the 1%. I know those aren't exact figures, but it's just a way of looking at it, right? We shouldn't be treating everyone like they're the most high risk and just imposing intervention based on the what ifs. We should be looking at that person as an individual and offering options based on that. So when someone is looking to hire us as a doula and they're talking to us about advocacy, and we have a whole episode about advocacy as well, but it is our part of what we do is if somebody is offering you saying, we really think you should do A, but there is B if you decide you want to do that. And then you ask the brains. And once you get that space, you ask me, okay, like, what do you think? Or whatever. I'm really not going to tell you what I think. I'm going to tell you the options and evidence. And I'm going to say, yeah, they offered option A and they said maybe you could do B, but they didn't even mention anything about B or that there's also a C and D. I will say that from my experience, C and D don't usually work as well. They are not as effective or whatever the thing is about them, but that is still part of your choice. Here are the brains, because I'm going to do informed consent at that point. I'm not going to make you ask me. I'm going to give you all that information. And then you get to make the decision. You cannot actually give informed consent to anything if you didn't know what all of the options were.
Right. I think one good example of this kind of shared decision-making informed consent model is with people that are considered advanced maternal age. So the recommendations by the governing bodies is going to be that if you are advanced maternal age, which means I think it's 35 or older is what they recently changed it to. If you're 35 or older.
Personally offended.
Yeah, which I think we also have an episode on advanced maternal age that goes into this. But if you're 35 or older, then they would recommend an induction of labor by 40 weeks, often at 39 weeks, just standard across the board. Because if you are advanced maternal age, then you're at a higher risk of things like, your placenta kind of starting to not work quite as well and different things like that. But that doesn't necessarily cover every single 35 to 45-year-old having a baby. There could be a 35-year-old who, or maybe as a 34-year-old who is not considered advanced maternal age, but maybe they have a really poor diet and lifestyle, and their placenta does start breaking down prior to that 40-week mark. That would be an indication of an induction. And then we could have somebody who lives a really great diet and lifestyle and is very conscious of their body and has done all of the things to prepare for pregnancy. And at 41 weeks, their placenta is chugging along just fine, because we have to look at all of those things. And that is that individualized care and that shared decision-making model of looking at you as the individual, your preferences, and then the whole view of you and your situation.
Part of why, doulas reduce trauma, doulas reduce all of these things is because we do this piece. We help bridge the gap when this piece isn't present. And one of the biggest reduction of trauma tools is being able to feel like you are part of the process, that nothing was done to you without you understanding what it was and that you got to make that choice. So if you're just like, I don't really care. I mean, they can just do whatever they want. Maybe that works for you, but it's very possible that in the process of that, you're going to incur some sort of trauma because you didn't understand what was going on. If it's okay if you go with your provider's recommendations, it's also still okay to ask questions. And if you are getting pushback from your provider during pregnancy when you're asking questions, that's a big indicator that when it's in labor, that is a very vulnerable time for you, any human going through that experience. So, that's a bit of a red flag. We want to make sure that you're not feeling like you asking questions is annoying. We want to feel like you asking questions is like, oh, good. You want to be a part of this process with your provider. Love it. And a good provider should love that.
Yeah. And I think it's important to note, like, when we're talking about these things, these are things that most providers are going to try to do. However, our healthcare system is not set up to allow the providers to do that with every single person. Your OB has so many visits, so many office visits happening every single day where they really can't spend more than 15 to 20 minutes with you in most situations because they have 50 other clients they have to see that day. Same thing in the hospital. We were just talking about this the other day, how one of the hospital practices that we work with that is made up of midwives, they are the ones that come in and do checks and triage. They spend a lot of time with their clients because they have a lot less clients. Whereas the OBs, they are going to be giving directions to the nurses and kind of giving orders in that way because they have a ton of clients on the floor at pretty much all times. And that's how our system is set up because America. But I'm getting spicy. But it's not necessarily that your provider does not want to do these things. It is that they are not being given the opportunity to do these things all the time. And when you're not being given the opportunity all the time, it does become less of a habit.
Yeah, for sure. And in labor, if it's less of a habit, in labor, things are a lot more rushed at certain points. And so then they really might not think about it. So I hope this was helpful. I hope that now you understand a little bit about how informed consent and shared decision-making go hand in hand. And as always, if you ever have questions about anything we talk about on the podcast, send us a message. We want to hear from you. You can go to birthbabypodcast@gmail.com. Send it over. We want to hear from you. If you have podcast episode topics you want, or you want to tell us, hey, you mentioned XYZ in the episode. Could you do an episode about that? We would do that. We would love to. Let us know.
Yeah.
And
or if you want to come on, come join us.
Yeah. You want to tell your birth story? Yeah.
Or got something else. I don't know. If you're
something crazy happened,
something or another.
Yeah.
Let's hear it.
We want to. We're like your best friend. So we will talk to y'all later. Bye.
Thank you for joining us on Birth Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.